Thanks very much. Great to have the opportunity to talk to the cancer program we have underway currently within the ministry. Giving a bit of context, I assume that's oh yeah, it works. This cancer incident started from the cancer registry, and we've had the cancer registry since 1948. And the bars are giving you the numbers of cancer registrations, and the green line is our age standardised rate. So you can see that even though the age standardised rate appears to be plateauing, possibly even decreasing, our numbers are going up. And that's just a function of our ageing demographics and increasing population. Similarly, with mortality, more age standardised rate appears to be decreasing, but again, the numbers are going up because of our population pressures. So how do we deal with all this? The other issue with this, as well as we have disparities going on and inequities. Following the previous speakers, we have survival differences between Māori and non-Māori. We know that we don't perform as well as Australia when it comes to cancer statistics. So how do we address these, and what are we doing? Currently, we have the cancer plan, which is bringing together our activity that we've got going on in the field, and this is really over the current 3 years, 2015 to 2018. And this is around how do we improve care for patients, improve access and timeliness of care, and let patients know what they can expect, and also what can our health professionals expect, and how we're going to do this. So the cancer program is actually trying to bring all this stuff together, and this is the work from the DHBs, the cancer networks, which have been in place since 2007, and the ministry itself. So the aim is to improve our cancer outcomes, focus on waiting times, access, quality, and of course we've got to take into account financial sustainability. So if we're having a look across the sort of pathway for cancer, so what are we doing in the sort of health promotion side of things? Now, most of our health promotion stuff sits with the Health Promotion Agency and also with the ministry, but one of the main themes is tobacco control and the Smoke 3 2025. We've also got the skin cancer prevention work going on with the Health Promotion Agency. If we get into the early detection space, we've got the National Screening Unit, and we've got the established programs with Breast Screen Aotearoa, as well as the National Cervical Screening Program. What we do know from these screening programs is that the Breast Screen Aotearoa has got a target rate of 70% intervention. Nationally, we are close to achieving that, but unfortunately for Māori, the uptake rate's only 65%. So how do we improve that? Similarly, for the National Cervical Screening Program, the target is 80%, and again, there is a disparity with the uptake that we're achieving with Māori. What we do know is if you do get people on the screening program for Breast Screen Aotearoa, there's data out of Waikato that if people who are on the program do as well, irrespective of their ethnic background. What are we doing in the cancer program within the ministry itself? There's a bowel screening pilot at Waitemata, which has been going since 2011, and as you're aware, the bowel screening program is going to be rolled out across the country in a phased manner, and initially the first few DHBs that are going to be taking this on further are Hutt and Wairarapa. We have the Cancer Nurse Coordinator program, which is about helping people navigate their way through the diagnostics and treatment pathway. This is a program that's been in place since 2012 and continues, and is going from strength to strength. We have the Psychological and Social Support program, which has been kicked off since 2014, and that's about getting better psychology and social work support for those that are going through the diagnostic process. We have the National Tumour Standards, which have been published across 10 major tumour types, and they were published in 2013, and that's about standards of access to therapy and diagnostics across New Zealand. So irrespective of where you are in New Zealand, you should have the ability and equal access to treatment. We have focused of work on multidisciplinary meetings. So these are the meetings where you're discussing people who have got newly diagnosed with cancer, how extensive their disease, what are their comorbidities, what other factors need to take into account to actually say, well, what would be appropriate treatment recommendations for these people going forward. These have been going from strength to strength. There are pressures with these. They take up a lot of time. Also, there's small tumour types such as sarcoma, which actually need to be done at a national level rather than a local or regional level. Further work we have underway is the National Radiation Oncology Plan. So this is in the area of radiation oncology and radiotherapy. So how many linear accelerators do we need to be dealing with the workload we've got coming through and the changing demographics? So we're doing modelling in this, looking at how do we treat people with different types of cancer, what interventions are we using. And one thing that's coming through from this is actually we do have different ways of treating the cancer around the country, so we don't necessarily have standardised pathways. We did work on medical oncology models of care, and that's looking at how do we use our workforce to again develop, to deliver care to people effectively. We know that we have more treatments available now than we used to have, and there's more treatments coming through. We know that people who get treatment are surviving longer, and they're surviving longer to go through even more treatment. So it's an escalating, burgeoning pathway of pressures on the service. So how do you deal with that when you've got a limited number of medical oncologists and nurses and pharmacists, and how do we actually adapt the pathways in service? There's also, why are we doing this in the hospitals? Why are we not getting this closer to home? How can we get chemotherapy out to the communities and improve access? We've had a service improvement fund in place over the last couple of years where the DHBs and the networks have actually focused areas of work on particular pathways in cancer care, or access to radiology, and that's really how do we improve the process. We've got the Cancer Health Information Strategy, which is actually looking at how do we use the data we're already collecting. A lot of the data we've got in the health system is related to counting volumes. It's not necessarily clinically relevant data, but how do we potentially use that to inform our clinical outcomes? Well, how do we strengthen that and start getting better transparency on how our system's performing and how the patients are doing? One of the key focuses we've had since 2014 is actually the Faster Cancer Treatment Health Target. And this is one of the 6 health targets that's reported on a quarterly basis in the papers. And basically this is looking at from referral with a high suspicion of cancer through to first treatment within 62 days. The target was to achieve 85% compliance by July of this year, with a view that this would then increase to a target of 90% compliance next year. So this is actually looking across a whole pathway, and this is actually quite a complex target. It's not just within one service. It's not a referral to respiratory and having a diagnostic process and getting to finishing the pathway in that one service. We're actually looking at referral to one service that may do the diagnostic process, then referral to another service, which is going to be the treatment service, and getting through that service and doing the whole lot within 62 days. We know targets can have an impact. A lot of resistance to targets in various areas. This is the previous radiation oncology target, which came into being in 2007. And at that time, we had waiting lists for radiation oncology, and we were actually sending some women to Australia for their radiotherapy for breast cancer. Waiting times were up and over 12 weeks in that time. So a target was put in place, which initially was through from being seen to having your treatment in radiation oncology of 8 weeks, and then that was shortened to 6 weeks, and then that was shortened to 4 weeks. And that was achieved consistently. That drove quite a lot of service improvement within radiation oncology to streamline services. Medical oncology was added to that target in 2012, when also chemotherapy was expected to be given within 4 weeks of being seen, and that was achieved at that time as well. So we know it can put a focus on an area which actually helps drive improvement, and we need to focus on how we drive improvement. What's happening with the FCT target? What we see here is when we first reported this nationally, we had a 66% compliance against that target. So meaning that of the patients that were being reported through to us at the ministry for this target, 66% were getting through within 62 days. Subsequently, we got up to 74%, which looked like we plateaued a bit, but on the recent data, which hasn't been published yet, we've actually got a further increase. So we're getting improvements. As well as cancer, it's actually, I'm sure you're all aware, the New Zealand Health Strategy was refreshed and published in April of this year. And that's about how do we fit the whole health program and what's our direction going forward. This has 5 strategic themes on which we're focusing, or which we're aligning all our activity. And these are the people powered, closer to home, value and high performance, one team and smart system. So all of these things were taken into consideration as we drive for improvement. A further bit of work that's currently underway is the health research strategy. This is still in evolution. As you will be aware, there was a public discussion document which was released in May of this year. Submissions closed late July, of which there was a couple hundred submissions back. July and August, there were further consultation workshops and good feedback. Some of the key themes coming through for the research strategy are prioritisation of research, the role of health service agencies, such as hospitals in health research, and a very strong theme around Maori health, Pacific health and disability research. That was a very quick overview through the current cancer program.